We wanted to just touch on ethics. Last week, I know you did your reading and did the discussion board, and we just wanted to give you a video just to highlight some of the important points from the content. So I'm moving on to the second slide. So what we're going to do in this video is we're just going to touch on why it's important to discuss ethics in relation to treatment planning and documentation. I know you've had classes, or if you haven't, you will have a class on ethics. Ethics should probably be weaved into all of your courses. And so I know that some of this is not new information, but we just want to challenge you to think about it from the perspective of this course material, treatment planning and documentation. I'll talk a little bit about the discussion board and leave you with some important points to consider. So ethical dilemmas. So there will always be times when we are challenged to think about ethics in our work as counselors. What is important is to be tuned into kind of recognizing when you find yourself in an ethical situation and then being prepared ahead of time to know how to work through that. And that's part of the challenge, I think, or part of what's important about your education is preparing you for that. And so that's what we're kind of hoping to do in this video, and also what we were hoping to do with the discussion board. So I think Dr. Newmeyer and I were both going to kind of share a personal experience of a time when we did find ourselves in an ethical dilemma, and just to kind of illustrate maybe how easily it happens or how unexpected. Did you want me to go first, Dr. Newmeyer, or do you want to?
Yeah, I can jump in here. So I suppose anyone that's been in the profession for any length of time has a lot of ethical situations you've had to grapple with, and that's certainly true for me. And I think my first comment around ethics and doing counseling and the whole package is to simply say no one sets out in the counseling field to find themselves in an unethical situation. So that in and of itself is important because people do end up in unethical situations. We know that it's a slippery slope. We know that it happens subtly. We know it sneaks up on you. It sneaks up on me. It sneaks up on all of us. And so paying attention to ethics is about developing, I think, a hypervigilance to swim upstream and against the pull of maybe even, I think from a Christian perspective, of sin. Or just sometimes doing a mid-course correction in our lives, right? So I remember my mom saying once when our house was dirty, it had things all over the place, she said, "Who sinned?" And we all looked at her. She said, "No one sinned. It just needs cleaned up. It's living in a fallen world. We just need to sometimes clean up." And so sometimes being ethically vigilant is just a cleaning up. It's mid-course corrections. It's catching up on things. And so, the ethical situation I would share in my own life is, and I know that there's probably people that can relate to this, and this has to do with documentation. I am not prone to do my notes. I found myself in my earlier days as a therapist saying, "Oh, I'll do that note tomorrow." And then, of course, tomorrow is tomorrow, and then tomorrow, and then you're a week behind, you're 2 weeks behind, and you haven't done your notes, and then you go back to write them. If you do go back to write them, and I was writing very scant notes that didn't really accurately reflect what had gone on in the sessions, and sometimes I would even miss those. And so, I very early in my counseling identity with supervision just developed a mantra and kind of the idea in my head and in my psyche, and that is, I don't go home for the day until my notes are done. And so that's not what I want to do. I want to grab my keys and get the car and get out of my office and be done for the day. But I disciplined myself to simply say, I don't go home until my notes are done. And probably since I adapted that kind of phraseology in my psyche, I would say there are probably less than 2 or 3 days in my whole clinical career that I've gone home without doing a note. It's been usually for something extraordinary, like I really had an important engagement that I just could not be late for. But and so that's my ethical vigilance and how I've handled that situation, especially as it comes to treating the chart.
That's great. I actually can relate to that. I think I struggled with that early on as well. And when I worked in the hospital environment, um, I couldn't go home without doing my notes. And so that,
Yeah.
and working there for 5 years, that really trained me. And so that I've carried that habit as well. It's just a good practice skill to have, or just a good mindset to think, okay, notes before leaving. So this ethical dilemma I was going to share isn't necessarily related to treatment planning or documentation, but I think it's a good illustration of how you can find yourself in an ethical situation without, um, intentionally making a choice. Or I guess you do make a choice, but just how easily it can happen. And so, as a young clinician, I was working in an outpatient setting doing counseling, and I had a teenager, and I was pregnant with my first child at the time, and she was pregnant. And so, we just talked a little bit about that experience. And when she had her baby, I thought that she had named her baby just the cutest name. And so, in a conversation with one of my friends, sometimes you might reference, we're very careful not to talk and disclose confidential information about our clients. But sometimes we may reference, oh, I had a client who was working on something, or I don't know, but you're very careful not to provide any identifying information. And I just very innocently said, oh, I have a client and she had the cutest name for her baby, and told her the name, and I thought nothing of it in terms of, I mean, she would have no way to know this person or live 40 minutes away. Well, a year and a half later, her mom started doing foster care work, and ironically ended up with that client as her foster child. And somehow my friend connected the dots because of the baby's name, when the baby was born, knew that she had been a part of the agency that I worked for because that's who was doing the foster care. And she said something to me about it, like, oh, I think your client is living in my mom's house. And I was shocked. Like, it really surprised me. And instantly I knew, oh, this is not good. She shouldn't know that I was working with this client. And then she took it a step further and asked me, should I tell my mom is there anything I can tell my mom about how to manage her? And I just how do I felt this pull of, oh my gosh, this is my friend. She's going to be upset if I don't tell her, if I don't say something. But I knew, like, oh, I cannot say anything about this client. And so it was a very stressful moment. And I worried for a long time about, like, oh, I can't believe I did that. It was just an example of how easily you think something is innocent or won't be connected back, but it very well can. So I learned from that just how important it is to really, that even just sharing a brief statement about some of the work you're doing, sometimes it's really a breach of confidentiality. And so we really need to protect the information that we're given in session, no matter what, how innocent or benign it seems.
Yeah, it's such a challenging area. And I think those of us, especially that are Christians, might find ourselves working in churches or working with people in the church. And I've always found that one to be just really fraught with potential pitfalls. And so even if I attend a big mega church with several thousand people, I've made it a rule that I won't do counseling with anybody in the church that I attend. It's just, the few times I've done it, it's just always backfired. I found myself then in a men's small group with, a client or, something like that. And so it just, again, I think the idea of ethics is we develop a hypervigilance about doing things that are right, because you have to think about it like this. Our clients don't come to us with an ethical code. We have an ethical code. And that ethical code is not only to protect the client, but it's really to protect us. But our clients, they don't have an ethical code, so they can go out and say whatever they want about what happened in therapy. But we don't have that same liberty. And again, it's to protect. The ethical code is to protect both the clients, but it's to protect us too.
Yes.
So.
Okay, so just a quick one. You guys did a great job on the discussion board. You had some excellent ideas. We really appreciated the thought that you put into your answers, and we were really challenging you to think from the perspective of, oh, I did do this. Now what do I do? And so I just wanted to, in case you didn't have a chance to review everyone's answers, wanted to have a chance to kind of summarize those so you know what some of your peers said. People talk.
Could I even just Could I even just say I want to pick up on that theme. The ability to stay in this scenario was really important to Nicole and I. For those of you that may have flirted around with the idea, like, well, I would never do this, I want to say you're probably at the most risk, and so because your perception of yourself is you can't err or make a mistake. And again, what I think ethics is about is the assumption that we can find ourselves in difficult situations, and how will we handle them, and how can we reduce the likelihood. But I think to say, oh, I would never do, well, again, most counselors do not start out thinking, I'm going to be dishonest with my clients and double bill their insurance. No one starts out doing that. So thank you for staying in the scenario and not trying to sidestep it. I think that was an important ethical choice you made in responding to our discussion boards.
Yes, I agree. And just to highlight, so you can see on the PowerPoint here, some of your ideas were to, immediately seek supervision, consultation, speak with your supervisor about what you did, do an ethics self-review. So not just looking at the ACA Code of Ethics, but maybe even taking a ethics refresher course. We're part of your CEU training. You can do an ethics focus training just to have a refresher. Admitting the mistake and learning from it, prayer, and several of you touched on remaining calm in the moment. So while internally you may be thinking, oh no, I'm busted and this person saw XYZ, and then maybe over talking to over explain and maybe making the situation worse, the client likely didn't see what you were doing. So there's no need to make the problem worse. But so staying calm and, thinking through what and thinking through, how to handle it as a professional, right? Because part of having, why we have ethics is because we are a profession and professionals. Okay, so moving on, just wanted to kind of touch quickly on documentation, because a big part of the treatment planning process is the written aspect of that, and letting others who you're working with know what the treatment plan is, or for the client's chart basically is the story of the work that you're doing. And so just a couple of quick notes about that. No matter what agency you work for, they will have their own agency-specific expectations, and for different reasons. And it's very important that's a big piece of being ethically responsible for your note writing, is understanding what is expected of you from those different agencies. And some of it can be because they have a special accreditation, like a card for accreditation, where they need to have specific things in the notes for their accreditation. And so, there's an ethical responsibility to make sure you're helping the agency be meeting their responsibilities. You want to be thinking about your audience when you're writing notes, who will be reading your notes, and what information do they need. Some information isn't really necessary. When I worked in the emergency room, we called her an over documenter, and we would read her notes and think, no one needs to know that this patient's dog's name is Toto. No one, and so you want to be, think about it from this perspective, that you're slowing down the other people who are reading the note. They don't, they need to know what they need to know. And also, you want to be responsible with your own time when you're doing your documentation. So, thinking about your audience, what information do they need to be effective working with the client and working together as a team, and be concise. So include what's needed and then leave out irrelevant information. All right. So moving on to the important points to consider. So this is just a summary list of the ethical principles, guiding ethical principles that you did in your reading. And so I'm not going to go through all of these and extra detail because you have done the reading, but just wanted to add a couple of extra thoughts in relation to these. So obviously, when no matter what, if we're talking about ethics related to treatment planning, or just generally, we want to protect clients and not do harm. And so, like an example of that is thinking about diagnosis, for example. We do have to submit diagnosis often for insurance billing but being mindful about what that diagnosis is, how that can impact the client, who has access to that. Just always be thinking about client protection. Reporting accurately, so writing up your notes to reflect what actually occurred, and not what's convenient, or not thinking about covering your own, but in terms of, like, if you're working with a client and you're doing something really important like a risk assessment, crisis assessment, and you're trying to support a case for hospitalization or not, you need to make sure that what you're saying is true, and not just to support your case to get the outcome that you want. So, avoiding dual relationships. The book was really focused on, being mindful of when someone comes in, if you have any relation to them whatsoever. Dr. Newmeyer was just talking about, thinking about who you're working with and how you may be connected to them. And it's important to be mindful of that. So treating people the way you want to be treated, and I'm going to tie this into the multicultural competence. Part of being ethically responsible in terms of treatment planning is thinking about cultural considerations. For example, if you're working with a client whose culture is more collectivist, and maybe it's related to marriage issues and women, or where the expectation is that they are married and not focus so much on individual and meeting their own needs. When you're thinking about the treatment plan for that client, you have to take that into consideration. You can't just, decide for yourself, like, oh, I think it would be best if this person really focused on their independence. You have to take into consideration their family dynamics and cultural influences. And so being...
Nicole, do you remember, you and I both worked in Columbus, so do you remember at Nationwide Children's working with any families that were Somali?
Mm-hmm, yeah.
Yeah, so I did too at Nationwide. And so there's a large Somali population that has settled in the Columbus, Ohio area, for those of you listening. And so you had some unique challenges as we would interface with the family. So for instance, a female could not be in a room without a male present, like her spouse or something like that. And so, we had to have these sensitivity to this cultural, to this people group, and it really changed the dynamics of how you did counseling or delivered mental health services. I'm sure you experienced that too. That's just a great example I thought you and I shared probably.
Yeah, absolutely. One of the issues we would encounter was related to time and how they valued time. So we would get consults a lot because the families would be an hour late for their appointment because they don't value time the same way. And so we had to do a lot of advocacy for the family with the treatment team to help them to understand why that's occurring. It's not that they're being neglectful of their child's care. It's a cultural issue. And so, yeah, absolutely. I'm glad you brought that up. And then finally, attention to competency. And I think that ties into some of what I was talking about understanding what's expected of you, but being prepared, taking your studies seriously now. So when you are working, you are prepared for doing notes and doing them well, because the documentation piece is very important. And then confidentiality, obviously I shared today a little bit about how easily we can, how important it is to protect all client information, as well as thinking about documentation, thinking about who's reading what, and again, what information needs to be presented. And so
what was that baby's name? Oh, no, you can't tell me. It's confidential. I tried to trick her. See, she's really good. She's just,
Won't make that mistake again.
That's good. That's good. Yeah. So, hey, maybe this is where we need to end. We need to always think about that. Find the humor in life and laugh at your mistakes too, right? So.
Yes, absolutely.
It's not all serious. Okay, I took you off script. Are we? So we're wrapping up by saying um, ethics are important. We'll all screw up. Have a plan for when you screw up, and learn to laugh.
That's perfect summary.
No, but you know what? One more summary, guys. Everybody, I know we're probably over time. Nicole had a great sentence, and I wrote it down. The client's chart is the story of the work you and the client are doing. That is a beautiful expression. So I just wanted to bring that up. I bet others of you heard that too. The client's chart is the story of the work you and the client are doing. So you're writing a book, and it's a serious book, and and it really needs to be accurate and reflect the work you're doing. So thank you for joining us in this YouTube. We'll see you in Collaborate in a couple of days.
Bye,
That'll
everyone.